We continue our series of discussions with the newly appointed directors of the VA systems across the state. This week we have Joe Vaughn, director of the Salisbury VA Medical Center here. Now, how do you plan to lead the center?
So my primary focus, right out of the gate, the first day I met with the employees, was customer service. One of the priorities for the VA has been more choice. So my goal is for the choice to be VA. If the veterans choose, and I'm a veteran that gets care at the VA myself, if they choose to go elsewhere, then in a short period of time we're going to become irrelevant. So my goal is for us to have the best customer service possible in the healthcare industry. And there's going to be things I'm going to want to bring to Salisbury to improve customer service. Not necessarily because we have horrible customer service as it is, but to take it to that next level.
I'm sure these things you learned in Jackson, your last location. Yes. How do you want to make sure that your facility becomes one of the top ones in the state and then eventually, hopefully, in the nation? What is your plan for making sure that happens? You said customer service is important. Right. What else do you want to make sure?
So obviously we want to deliver great health care. And then, most VA structures are, they were built in the 50s, 60s, so the buildings are aging. So keeping up, modernizing the facilities. At Salisbury, we have one of the first 3D mammograms, in the state within VA. And so keeping the buildings modern, doing things like the text messaging alerts for appointments, staying on the leading edge of technology. VA's always been out in front. It's one reason it makes it such a great place to work is we're always on the leading edge of technology. So jumping out and doing those things at Salisbury that are great patient satisfiers.
Besides bringing in the cheer wine and good stuff in Salisbury, how do you help to get into the community more and be part of the community as a VA system? Obviously, the veterans are who you're there to serve, but that includes the families and everyone around the community. How do you make sure that continues to be part of it? So
actually, in the short time I've been there 4 weeks now, I've already started attending some of the veteran coffees, so I can be accessible directly to the veterans. Talk to Chamber of Commerce, Rotary Club, some of those organizations that our facility, the VA facility in Salisbury is a large part of the community. So by being involved in organizations, being involved in the veteran service organizations, and having a presence in the community and making ourselves accessible, I think gets us more in tune with what veterans want and where we need to make adjustments in the system.
Yeah, how do you make that reality change and that perception change for these veterans who might have not had a good experience in the past? How do you bring them back into the system? How do you make sure that they'd say, okay, I'll give it another chance, and you are offering what they need now?
Right. So I think when the director actually gets personally involved and actually listens to, okay, what happened? How can we fix this? And actually reaching out and then actually following through and making sure that whatever didn't go right gets fixed, not on a one-time basis, but on a recurring basis, so it not only doesn't happen to that veteran, but to any other veteran again.
I know you mentioned the coffees as a great way to coordinate with those veterans in person, out in the field. What are other ways that you want to try to reach out and be a part of the veterans community? You said a lot of different things. You said the coffees. You said making sure you're part of the organizations as well. Right. But just how do you open the doors, I guess, to make sure people understand where you're at? So
one of the other ways is when there's other outreach events, like this Saturday, I'm partnering with one of the congressmen that's having an outreach event. So we'll have enrollment and eligibility teams there. I'm personally going to go and making it easy, where a veteran doesn't have to come fight for a parking place and then try to figure out where he needs to go or she needs to go to enroll, but to be out in the community and meet them there and do the enrollment process right on the spot. So when they actually come in, it's for their first appointment.